I'm Dr. Jonathan Klar, and this is an example of our computerized device called non-surgical spinal decompression. This table and this device is very effective in patients for patients that have chronic pain. And you may be one of those people that have the chronic back pain, the herniated disc, the sciatica, the nagging pain. You can't sit, you can't move, you can't walk. Spinal stenosis. This helps this in a very conservative fashion. Up till now, what are your options when you have these things going on? Well, your options are medication or possibly even injections, which we know from the literature is more or less just an expensive Band-Aid. You may go to physical therapy, which can be effective sometimes, but oftentimes it can even make the problem worse if the patient's inflamed. I'll see that with a patient that has a herniated disc. Sometimes they're inflamed and moving more actually can aggravate it. Or possibly even surgery, which you know from many friends or coworkers can be unsuccessful as well. So this device helps those kind of conditions in a non-surgical way. You can see we've got the belt wrapped around me here, which helps distract the lower part of the pelvis and really focus on that lumbar region. And we can change the angles accordingly depending on where the actual injury is. Patients can be treated face up, face down. How about the success rate? Well, it's very successful. Research has said that it's about 86% successful for herniated and bulging discs. And in fact, the Journal of Neuroscience actually stated a few years ago that any individual considering surgery should undergo this first before there's permanent alterations made to the spine. So those two things in itself, and the clinical experience we've seen here, it does very well for chronic pain issues. But the key is not just getting out of pain, although that's great, but we want to focus on getting it to stabilize and heal and then rehabilitate, which is why we use a lot of functional rehabilitative exercises in our office once you're ready for those things, along with ancillary procedures we can use in addition to get that pain down, such as high-powered laser and pulsed electromagnetic frequency. So there's many things we do in our office to help herniated and bulging discs. This is one of them that proves very successful. And it's just another example of something we use in our office to get you better.
All right, we're here with Mr. Roycroft. And Mr. Roycroft, you came into our office with a lot of chronic lumbar and disc issues. Can you give me a little bit of background about your complaints?
Yes, I had back pain, lower back pain, for a number of years. It grew increasingly worse, and it was really become a concern to me and also to my family. Well, my daughter has a little dog which became impaired, and a veterinarian used a laser treatment on the dog, and after 6 treatments the dog became a frisky puppy again. So when I came to Jonathan, he asked me who referred me, and I said, well, I think it was my daughter's dog. Well, to make a long story short, the combination of the laser treatment plus the spinal traction, which was recommended by a friend of mine who's my age and has a similar condition, Jonathan was able to supply both of those treatments that no other chiropractor in the area had the capability of. And so I now am approximately halfway through my treatment program. I have played golf 3 times since I started this, which I was not able to do before I came here. Also, I can even walk around Costco with my wife, which I couldn't do before. And I suppose that's a positive, but it depends on how you feel about shopping in Costco. It's an arduous experience, as you know. In any event, I'm indebted to Jonathan, and I've recommended him to a number of my friends who have ailments. And if my daughter lived in this area, I would bring her here to have him treat her migraine condition.
Very good. Well, you've done excellent in our care, and we really appreciate you as a patient, and thank you for your time.
Sure.
All right, we're here with Mr. Heiner, and Mr. Heiner, you came into our office a few weeks ago with complaints of chronic low back problems. It's kind of a comical story. Why don't you tell me a little bit how it started?
Well, I was in a lot of pain, toes pretty well numb on one foot, and I had real chronic pain. I couldn't stay in bed, couldn't stand to lay down, I couldn't recline back in a recliner. I was sleeping more or less sitting up.
Just to interject, that's not the comical part of it. That's the serious part. I'm sorry.
But anyway, I was looking really for a neurosurgeon, and a friend of mine had had surgery before by another doctor, and we called and supposedly got his name and number, and so I came here to Harrisonburg looking for another doctor who I thought was a surgeon, and I couldn't find one in the building, and so I come in the office here, which is Shenandoah Chiropractic, and it turned out that the doctor I was looking for that I'd been given a number to was a chiropractor, neurologist, and so through his treatment and good care and his staff, I don't know, I guess it's been going on 4 weeks now, or starting on the 4th week, and 2 days a week I'm able to stay in bed the biggest part of the night now, and the biggest part of the time if I have pain, it's a low pain, and so I'm back to piddling some, as I call piddling instead of work. I can't really work, but I enjoy trying to and staying active and busy, and I really appreciate and thankful for all the help that I've gotten.
Well, we're really excited to have you as a patient. You know, the main thing which is interesting is you were actually coming to our office thinking we were surgeons, and we're not. And with the care, with the laser therapy and the decompression and the treatment we've been doing on you, you've literally done a 180 to come into have a numbness in your feet and really just desperate for pain relief, looking for a surgery, to not knowing this was available, conservative, that you didn't have to go under the knife to get these kind of results. Was pretty exciting as far as on our part to see things like that. I know you drive, I believe it's about, what, 2.5 hours one way to get here?
Yeah, about 2 hours.
Yeah.
A little bit over 200 miles round trip.
Right, so it's quite a hike to get here for you, and I know it's not easy, but you've been doing really well making the commitment, and that's why your pain levels are, you know, where they are, because of the commitment you've made. So we're just super excited that you're doing so well, and we're really happy to have you as a patient. So thank you so much for your time.
I appreciate you taking me for a patient too.
All right.